Welcome to our icometrix webinar. Thank you so much for tuning in from all over the world, and good morning, good afternoon, and even good evening for some of you out there. My name is Eline van Vlierbergen, and I will be presenting this icometrix webinar about our icobrain portfolio. And I'm joined by Femke, who will be moderating this session and will answer your questions during and in the dedicated Q&A. Femke and I are located in our US office in Chicago, so it's still bright and early for us. We haven't had any coffee yet, so that's our disclaimer for this webinar. But as you probably know, icometrix is actually a Belgian company founded in 2011 in the beautiful Leuven. Back then, we were all about innovative research and clinical trials, and throughout time, we translated this expertise into a clinical AI product, which you all know today as icobrain. So today we maintained our focus on research and clinical trials, which continue to fuel our further clinical developments. As mentioned, the content of this icometrix webinar is the icobrain portfolio, and I will walk you through this in approximately 30 minutes, which leaves us 10 minutes for a Q&A to answer any questions you might have. My personal goal today is to give you information on why brain quantification matters, how this would fit in your workflow, and really give some practical advice on the interpretation and the use of icobrain. A quick slide, I promise you it's the most boring one of the entire presentation, indicating our intended use, which is the automatic labeling, visualization, and volumetric quantification of segmentable brain structures for both MR and CT. The main important part of this slide is to remember that our icobrain solution is not disease specific. However, we did consciously decide to put disease-specific measurements in our individual reports. More about that later on in the presentation. So let's first tackle the question why brain quantification matters. And the general benefits of doing this is really the objective and standardized way of reporting imaging biomarkers. It helps you drastically cut down reading time by providing volumetrics with normative references on the one hand and color-coded segmentations on the other hand. This can improve the intra and inter-rater agreement and therefore bridge the gap between subspecialized neuroimaging readers and less experienced one. All of this also helps with the communication between the radiologist and the neurologist, but also the neurologist and the patient who can better conceptualize what is going on in their brain. And this added information allows also to track subclinical disease progression, to improve the early detection of disability, disease progression, and treatment response. So all of this really contributes to the enhancing of your productivity and to improve the personalized care of your patients. So in the next slide is an example of a section in a typical radiological report of an MS patient, where the presence of lesions and atrophy is reported in a rather subjective way. With icobrain, we really want to provide an objective framework by means of a report with normative references data on one hand and color-coded segmentations on the other hand to help you incorporate objective metrics in an otherwise very tedious and subjective assessment. How we accomplish this is very simple. This slide indicates and describes our workflow, which starts with the input data, which can be pushed from the scanner or the PACS directly to our secure cloud, where the data is analyzed and then the results are pushed back right into your PACS. So by the time the radiologist opens their PACS session, they will have the original data, the color-coded segmentations, and the report all in one place. And this is made possible by our DICOM router, which is installed in your center and which will anonymize all the data before it leaves your hospital. So now that we know the general benefits of brain quantification and also how this can fit into your workflow, let's look at the icobrain portfolio in more detail. As mentioned, we chose to incorporate disease-specific measurements into our reports. We have 3 reports: icobrain MS for applications like MS, icobrain DM for applications like dementia, and icobrain TBI for MR and CT for applications like brain trauma. I will walk you through these different reports, and we'll mainly focus on MS since there's a lot of overlap between the reports themselves. So with each report, we try to tackle a disease-specific challenge. And in MS, this is the high percentage of suboptimal treatment response in MS patients. With brain volumetrics, we help the early prediction of disability progression and eventually want to reduce the patient's time on a suboptimal treatment. So what we really try to do is track disease progression in already diagnosed MS patients accurately and objectively to ensure that the right treatment goes to the right patient at the right time. This looks as follows. Our icobrain MS report consists of 2 pages and will first focus on the first page, which really focuses on the white matter abnormalities. So every page consists of the info section where you can find some information on the patients, which MRI dates are included, and also the year of birth of the patient as a reference. We also have a QC section incorporated in all our reports, which indicate the quality of the original data and the segmentations and their effect on the interpretation of the volumes. We also have some visual results, which is just like a snapshot teaser of the complementary DICOM segmentations that we also return to your packs. And then we have, of course, the most important part, the white matter abnormalities. For MS, we really objectively assess the flare white matter hyperintensity dissemination in space and time by providing information on the flare white matter hyperintensities, the T1 hyperintensities, or the contrast enhanced T1 lesions, and T1 hyperintensities or black holes. For this, we provide the volume, but what is of real interest in MS is, of course, that volume change. And because MS lesions can be very dynamic, we break this down into new, enlarging, and shrinking lesions. You also see the visual representation of this information on the bottom of the page, and let's zoom in on this to further assess what is going on here. So we can see that we color code and represent the lesions based on their location. We have paraventricular, juxtacortical, and infratentorial as described in the McDonald's criteria. And then we have a 4th category, deep white matter, which you can kind of consider as all the lesions that don't fall in the above mentioned categories. So in this graph, we can easily see the entire lesion evolution going on in the patient's brain. The first line indicates the first time point, the second line, the second time point or the current time point, and then we have the volume change. As mentioned, because of the dynamic nature of MS lesions, we break this down into new, enlarging, and shrinking. And this really helps you to see what is going on. For example, we can see that there is a slight increase in the paraventricular lesions, a slight decrease in the juxtacortical, whereas the infratentorial and the deep white matter lesions are pretty stable throughout time. The second page of our report, again, contains some information and visual results, but what is really important here are, of course, the brain volumes. In MS patients, we assess the whole brain volume and gray matter volume, both the volume and their normative ranges, which are also represented in the population graphs below. Since we are absolutely interested in tracking disease changes over time, we also report the annualized brain volume changes for whole brain and gray matter. We analyze these brain volume changes to make it easier to interpret, since not every patient gets a scan exactly 12 months apart. To help you really interpret what this atrophy means, we also report a normal annualized volume change, which actually reflects the volume change we would expect to see in a healthy person of the same age and same gender. Next to the report, we also send back the segmentations, and in our icobrain MS, these are actually three sets of segmentations. The first two segmentations are sent back when we receive one time point, which is our cross-sectional comparison. So if we have one time point, we will return an overlay on the T1 indicating the gray matter and the T1 white matter hypointensities, and also an overlay on the flare with the lesions color-coded by location, being juxtacortical, paraventricular, deep white matter, and infratentorial. The interesting thing is, if we have a follow-up scan, we can really indicate the lesion evolution by means of an additional color-coded segmentation, indicating new lesions in red, enlarging lesions in orange, and stable lesions in green, really making your life easier in tracking lesion changes and lesion evolution throughout time. All these segmentations are available in all the different planes to really help you further speeding up your radiological reading. So this slide is actually to nicely represent how the whole brain volume, being a predictor, an indicator of the brain reserve, and whole brain volume change, being predictive of the long-term disability, help to paint a picture of the disease progression within a patient. So here we see two patients, one female, 29 years old, the other female, 38 years old, with a very different normative percentile. So the younger female clearly has a much lower normative percentile, indicating a lower brain reserve, indicating that she might be more sensitive to excessive atrophy. However, when we look at the brain volume changes, we see that the female of 20 years old is pretty stable throughout time, whereas we see a very aggressive atrophy in the 30-year-old female. The same 30-year-old female also represents disease activity in the flare white matter hyperintensities, which are indicated here in the color-coded segmentation. We can clearly see that there was no lesion in 2016, but there is a new one in 2017. And this is also nicely represented in the table underneath as new lesions. Something super exciting about our icobrain MS that we recently launched a natural language report at the European Conference of Radiology in Vienna. The natural language report converts brain volumetrics and population statistics into an editable natural language report that can be easily copied into the radiological report. So this format really allows you to further standardize and speed up your reporting. Let's move on to our Echobrain TM report. As mentioned, different report, different challenge. And with Echobrain TM, the challenge we try to tackle is really the early and accurate diagnosis of the most common dementia types. How we do this is by means of these reports. Again, the Echobrain TM report consists of 2 pages, and the first pages really uncovers abnormality patterns in dementia-specific brain structures, being the frontal cortex, the parietal cortex, temporal cortex, and hippocampus. You can see that this report is very similar, has a lot of similarities to the Echobrain MS report, has the numeric values, the population graphs, but what is new here is the volume signature. So let's take a look closer look at the volume signature. So the most common dementia types are hallmarked by specific atrophy patterns, which you can see on the top of this graph. For example, Alzheimer's patients will have an excessive hippocampal atrophy and to a certain extent also temporal atrophy and parietal atrophy. This can be nicely reflected in our icobrain structure signature, which really indicates which brain structures are involved in the disease pattern of this individual patient. The result of this is really nice signatures that correlate with the differential diagnosis of dementia. Here we can see an example of a healthy individual where all the 4 points are nicely centered around the middle, whereas an Alzheimer's disease patient will have that typical diamond shape with a high peak in the hippocampus and some involvement also of the parietal and temporal cortex. Whereas in a frontotemporal dementia patient, we will see high peaks in the frontal cortex and also the temporal cortex. So these signatures really give a beautiful snapshot of what is going on at a certain point in time in this patient's brain. If we consider brain volume changes in DM, we can actually also plot this on our signature. In this slide, you can see the previous time point indicated by the white dashed line and the current time point by the solid black line. A good rule of thumb here is if the area between the 4 points expands, we are looking at a more excessive brain volume change than we would normally expect in a normal, healthy person. We can even go and look closer in all the 4 points and distinguish 3 different scenarios. The first scenario is overlapping lines, which indicate that the rate is in line with the normal brain volume change rate. The second situation is actually a saturation of the brain atrophy in this structure. And the third scenario is really a clear shift towards the outer circle of the second time point, indicating a rate exceeding what we normally would expect in a healthy age and gender matched normative population. Recently, we also included a second page to our Echobrain TM report, which includes information on the whole brain and the lateral ventricle, which really allows you to appreciate whether there is any lateral expansion of the lateral ventricle with or without any involvement of whole brain atrophy. And this can really help in distinguishing normal pressure hydrocephalus patients. Last but definitely not least is our Echobrain TBI report for CT and MRI. And with our CT report, we really focus on brain trauma in an acute setting. The challenge here is really the practice variations in acute TBI, which negatively influence outcomes and also healthcare costs. So with our reporting, we provide a standardized interpretation of non-contrast head CT scans. Again, to ensure that the right patient gets the right treatment at the right time. The TBI report looks as follows. Again, a lot of overlap with the other reports. We have an information section, QC section, some visual results, and then really all the information, the standard quantification of mass effects. Here we report hyperdensities, midline shift, and cisternal compression in the suprasellar, prepontine, ambient, and quadrigeminal cisterns. We also have a nice visual representation there of the cisternal compression. This report actually reflects the variables that are also included in current CT scoring system, like the Rotterdam scoring, Helsinki, and the NIRIS scoring. So with our reports, we really provide a way to easily integrate such scoring systems in your clinical practice. We also have the Echobrain TBI for MR, and this is really focused on MR scans for patients who have an apparent normal head CT, but potentially show signs of cerebral injury on the MR. So in this report, we assess the acute axonal flare white matter hyperintensities and the chronic brain volume changes to initiate traumatic axonal injury directed therapies at the right time. This report looks at follows, where we focus on brain volumes and brain volume changes in the whole brain, cortical gray matter, and in the hippocampus. Next to this, we also have a strong focus on the flare white matter hyperintensities, or the traumatic axonal injuries, and their distribution in subcortical, cerebellum, corpus callosum, and brainstem. So it's a very similar report to our icobrain MS report. However, the big difference here is that our lesion location is really tailored to brain trauma and is in line with the Adams-Gantry staging, which clearly shows that there's a correlation between lesion location and relative risk for unfavorable outcome. That brings us to the end of our presentation, and these are very briefly the take-home messages. I really hope that through this presentation I was able to demystify some of icobrain's core benefits and highlight our disease-specific approach. At this point, I would like to encourage you all to subscribe to the icometrix newsletter, to also stay up to date about any upcoming webinars, conferences, and product launches. And please do not hesitate to contact us also after the webinar via our email or by phone.